Hello, I'm Bola Shonubi and I'm the founder of Hope Clinic, private practice in London, and I'm also a member of Counselling Directory. And I'm here today to speak a little bit about borderline personality disorder, which is also referred to as emotionally unstable disorder. So what is borderline personality disorder? It is a disorder that is characterized by feelings or intense feelings which are unstable. One minute you can feel anger, the next minute you can feel really sad or really happy. Very, very unstable and intense experience of emotions. A lot of the time it's caused by trauma in early childhood. It's characterized also by feelings of abandonment, feelings of disassociation, not feeling yourself, feeling detached from others, very negative views of yourself, splitting. By splitting, I mean black and white thinking. There are lots of symptoms or characteristics of borderline personality, but most of the time it's about having intense moods which could change within minutes, hours, and last for minutes and hours. And it's experienced by individuals who have had usually traumatic childhoods, maybe parents who are not necessarily there for them, emotionally, physically, or otherwise, who experience trauma. And when I say trauma, it doesn't necessarily mean overt abuse, like sexual abuse or really severe neglect, physical neglect. It could be complex, like experiencing trauma every day in a way that there was emotional neglect. For example, a child could have everything physically and materially, but wouldn't have the emotional comfort of mother, father, or primary caregiver. That results in feelings of abandonment, when the child grows up, becomes an adult, and that constitutes part of borderline personality disorder also. It also is characterized by self-harm, when the person feels self-loathing and harms themselves, or there's no other way to feel, so they harm themselves. Also, suicidal ideation, suicidal thoughts. So how do you treat this? How do you treat this disorder? Most commonly with talking therapies, psychodynamic psychotherapy, which I offer, which goes to the root, which tries to get to the root cause of the disorder. So we can work through it, understand where it's come from, and make it less of an issue, make it less of a problem. Just trying to understand why or where it came from. Could it have come from abusive parents? Could it have come from loss of a loved one? Could it have come from abuse? We'll find out where it's come. We'll try and find out where it's come from, so we can treat it. Can it be treated with medication? Not necessarily. Sometimes GPs may prescribe medication, but they prescribe medication when it has also maybe anxiety or depression attached to it. Most of the time it's treated with talking therapies, psychodynamic therapy, CBT, DBT. All these therapies are very helpful when it comes to treating borderline personality disorder. And it's not something to be ashamed of or embarrassed by. It's a disorder which is not your fault, which can be treated. So if you do see yourself in what I have briefly described, why not reach out and get some help? Make a call to myself. I'm at Counselling Directory. You can find me in Counselling Directory, or at my website, which is hopec.uk. That's hopec.uk. Well, take care, and I look forward to hearing from you.